Good morning, midwifery student. I am your teacher for today in Mid 101, Session 1. Before anything else, I will introduce myself. I am Cheryl Jade A. Hassan, a registered midwife and also your college professor in Allied Medicine Department. So, our topic for today is signs and symptoms of pregnancy. But before going to that, I would like to explain to you what is pregnancy. Okay, pregnancy, also known as gestation. It is the time during which one or more offspring develop inside a woman. Pregnancy usually occurs by sexual intercourse but also occur through assisted reproductive technology procedures. Pregnancy is a gestation, so it is the time when the baby is developed inside the uterus of the mother, usually one or more offspring. It's depend if it is only single or twin, whatever, like that. And without sexual intercourse, it wouldn't be happen the pregnancy. And also, it can be possible by a technology for now, just like in vitro fertilization. But usually, this kind of technology is common in the United States of America, like that. In other countries that are, they have this technology, but as of now, in our country, in the Philippines, I don't think so that we have this. So, this is the way on how the woman can be pregnant is through sexual intercourse and these technologies. Childbirth typically occurs around 40 weeks from the start of the last menstrual period. So, the period of pregnancy can be 37 to 40 weeks age of gestation. Just imagine, it will be exactly or completely 9 months. So by counting your last menstrual period, you should start by which day your period begins to flow. It says here that if you want to count your last menstrual period, to know exactly what is the age of your gestation if you are pregnant, you will start with the period begins to flow and not by the last day of flow. So if you got your menstruation for today, it would be your last menstrual period and not the end of your menstrual period. Okay, so we will go to our main topic, the signs and symptoms of pregnancy. There are three categories of signs of pregnancy. The first is presumptive. The second is probable signs. The third is positive signs. So, why there is a category? So, we will know by now. We will know it by now. So, presumptive signs of pregnancy is a sign that a woman is experiencing, she is feeling or experiencing that makes her suspicious she may be pregnant. So this is only a speculation and this is not really confirmed, not definite. Only just she feels something that is merely like a sign of pregnancy. She is thinking that she is pregnant because she is experiencing like this, okay? So there is an abbreviation of the presumptive signs. The abbreviation will be presume. Presume means the letter P is period absent. So any one of us, if we have a husband and then we are expecting to be pregnant, when our period is absent, so we are thinking that we are pregnant, like that. So that was you called presumptive. Okay, the next abbreviation is R, really tired. So a woman with expecting that she will be pregnant, and then she is experiencing really tired, fatigue, and then anything she do, like walking, like anything that can make you tired, and then she's thinking that she is pregnant already, because that was also a sign of pregnancy. So letter E, enlargement of breast. Letter S, sore breast. So enlargement and sore breast. This was also a sign of pregnancy. But not every enlargement and not every sore of breast is pregnancy. There are times that there are some disease like causing this kind of enlargement and source of breast, not only pregnancy. So it must be presumptive. Okay. Urination increase. The letter U is for urination increase. So as a woman that expecting to be pregnant, when she was experiencing urination is increased, her urination is increased, so she will be presuming, what you call this, presuming that she is pregnant already. But as what I've said earlier, not all the increase in urine is pregnant. So there are some diseases or illness that can cause urination increase, just like urinary tract of infection or any kind of like diabetes. They are experiencing increase of urination. So not all of that is a positive, or what you call this, a pregnancy pregnancy signs. Okay. So letter M, movement of the fetus in the uterus. Woman perceive fluttering sensation in her lower abdomen. So there is something moving here in her abdomen. Of course, as a newly, or as a woman that really wanted to be a pregnant, or something that is, she has fear of something that she's pregnant, like that. So she will be thinking that moving something in her abdomen is already a pregnancy. But not all of that is a signs of, and not all of that will be a pregnancy. Okay. Mss and nausea. Letter E for Mss and nausea. Okay. This will be the vomiting, and the nausea, the nausea is like nahihilo sa atin. And then a pregnant woman will experience these signs, of course, but it can be also the other thing, like diseases, or sometimes when your BP, when you have hypertension, or your blood sugar level is down, so you will be experiencing this kind of signs, emesis and nausea. But not all of this will be pregnant, that you will be a pregnant, like that. Okay. So that was only a speculation and unconfirmed. So remember, student, remember that presumptive is only a speculation and not confirmed. Okay. So we will go to probable signs of pregnancy. Probable means likely to be the reason, probably, very likely. This will be very close to the positive. Because in this case of probable sign, there will be included the observation and the documentation of the healthcare provider, the nurse, the doctor, like that. Okay. There will be an equipment also used in this type of category. So probable has also an abbreviation. So we will go to letter P for probable. Positive pregnancy test. When you see positive pregnancy test, of course, you have the equipment, you have the evidence, let's say evidence, that you are already pregnant because it was positive. But It's not really 100%, still not 100% positive. It can be positive, or it can't, because not all the positive pregnancy test is confirmed, because sometimes there were a cause like change in the hormone, that you have this more on your um, just it can be a pregnancy test that you're more on what you call this, progesterone or estrogen, like that. If it increase, then it will be positive in your uh, pregnancy test, just like that. Okay, so returning of the fetus, bouncing back of the fetus. So in this case, as a healthcare provider or a midwife, when you do Leopold's maneuver, so when you palpate the pregnant, or what you call this, your client, and then you can feel something that is moving inside, also exchanging your palpation, like that. So you will document it to your, just like prenatal checkup. So we were doing it in our health centers and hospitals. So when you feel it during your palpation, sorry, so you must think as a healthcare provider that the woman is already positive because of that sensation. Okay, so letter O, outline of the fetus can be palpated. So outline, it's saying here that outline, when you palpate the abdomen here, so there is already a shape, just like a fetus shape inside, that you can see or you can feel, like that. So that was also a probable sign, that because you wouldn't know that it was already a fetus or something like disease, like that. Okay, so Braxton's Hicks contraction, false labor. So they are not regular and won't result to cervical dilatation. So there is a contraction. So when a woman is pregnant, there will always be a Braxton's Hicks contraction during it may be during 7 months, like that. But in this case of this false pregnancy, or what you call this probable pregnancy, there will be a sign of Braxton's contraction already, and they are thinking that it was already signs of pregnancy by the healthcare provider and also by the mother, including the mother. So letter A, softening the cervix, Goodell signs happens around 6 to 8 weeks of gestation. There will be a softening of the cervix also. Bluish color of the vulva, cervix, vagina due to increased blood. So during examination, the healthcare provider, she can see through the vagina, or let's say when she examined it, there was already a bluish color, discoloration. So also the healthcare provider see it, so also she noted it in her notes, like that. So lower uterine segment becomes soft Hager sign around 6 to 12 weeks of gestation. So the Hager signs is already there. So the lower uterus here becomes very soft. So that was a probable sign of pregnancy, because every pregnant woman experienced that. But as what I've said before, not all the softening of the cervix or the lower uterine segment could be a pregnant or something. It must be something that there is a phenomenon from the other causes, the other reasons of why it was happening. Okay, enlargement of the uterus. This is the when every one of us see, of course, we don't know really the woman that we are passing by, so we can see her abdomen is very large, whatever, like that, and then we are thinking already. So as a healthcare provider, we are also thinking that that woman is also pregnant. So that was you call probable sign, because not of all enlargement, there is some series of enlargement like tumor, like that, cancer, whatever, that can cause enlargement, not only for pregnant woman. Okay, so we will go now to, so we will go back to probable sign. Presumptive is only a speculation, not what you call, not true pregnancy. And then on the probable sign, it could be positive or negative. There would be the um, there would be the examination, what you call this, documentation, observation, and involvement of healthcare provider like nurse, midwife, or doctor, like that, in the probable signs of pregnancy. So we will go to the positive sign. So this is what we call positive signs. Positive means conclusive, definite, or absolute. Okay? These signs are present because they can only be attributed to a fetus. When you say positive, there will always be a fetus, a positive sign. There is no other cause. The woman is definitely pregnant. The sign will deal with the baby being the evidence itself. So fetus, the abbreviation for now is fetus. So we will go for the F. F, fetal movements felt by the doctor or nurse. So this will be, I think this happens when you do Leopold's maneuver. The fetal movements felt by the doctor or nurse, it's just similar with the probable sign, the palpitation. But this time, it was already the fetal movement. Not only the, what you call this, tumor, whatever, like this in the abdomen. Maybe this will be palpate during second trimester, like that. It was really positive. Not in the first trimester, but this was happened in the second or in the third trimester, that the fetus is already moving. Okay, so letter E, electronic device detects fetal heart sound, so by using a Doppler. By this time, you can heard already the fetal heart tone, chug 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 chug, like that. And then of course, not everyone inside our abdomen is making sounds like that. Only the fetus itself. Okay. Number 3, or the letter T, the delivery of the baby. Of course, when there is a delivery of the baby, there will always be a positive sign of pregnancy. Natural, okay, di ba? Kung nanganak na yung babae at may lumabas na bata, syempre positive na yun. So, ultrasound detects the fetus. Letter U, ultrasound detects the fetus. Visible sa ultrasound, by using the ultrasound, you can see already the fetus. Positive signs of pregnancy, all about fetus. Okay? Letter S, see visible movement of the baby by the doctor or nurse. Okay, yung makakakita lang nito is yung doctor or nurse or midwife, yung mga expert lang talaga. So makikita nila yung totoong galaw ng fetus sa abdomen. Hindi sila magdadalawang isip dahil trained na sila, kumbaga expert na sila sa mga ganyan. So yun na yun. Napaka-positive na niya. Hindi lang siya pregnancy test kit, hindi lang siya kung ano-anong whatever na outline dito sa may abdomen, hindi lang siya ganun. So, totoong fetal movement by the examination of the doctor and the nurses. So, ngayon, for now, you can differentiate already the categories of signs and symptoms of pregnancy. The presumptive, the probable, and the positive. So as a student and me as a teacher, I wanted for you to study it and to review it for you to know. And when somebody asks you as a midwife student, you know already, oh me, I know already the difference of presumptive. It was just an speculation, whatever. And also with the probable, it was the involvement of the nurse and the doctor is there. There is something palpitation, whatever. Palpation, what I mean is palpation. There was already something like examination. By the help of the healthcare provider, there will be an equipment like pregnancy test, but it's still not 100% that it is positive. So when you go to positive sign of pregnancy, remember always the abbreviation fetus. Without a fetus, there wouldn't be a positive sign of pregnancy. Okay? So for now, student, I wanted from you to make a examination, a written examination, what you call this, a quiz, a reflection or what you call this, I will give to you. So by the end of this lesson, I would like to give you some short quiz. Okay. Please keep your notes and just remember all about what I say lately, what you call this, what I explain. Maybe you can reflect something or you can remember something. So I would like you to do an essay. Okay, essay. The first question I will give you, explain in 50 words of what is pregnancy. Okay, in 50 words. So, okay, take note by that. Take note first of my first question. So, my second question is enumerate the 3 categories in signs and symptoms of pregnancy. What are these 3 categories? Okay, just write it in a piece in your paper, of course. And number 3, last but not the least, I wanted from you to explain briefly what you call this, differentiate the 3 categories of pregnancy. So the second question is, what is the 3 categories of signs and symptoms of pregnancy? The third question is, differentiate it and explain it briefly by 50 words each. So the total of this quiz is 100%. So when you explain it briefly and reflect it briefly, I will give you 100%. It's depend to your explanations and to your reflections and regarding to what you recall or what you reviewed or what you remember by my explanation. Okay. I hope for this day that you learn something from me by this 30 minutes of discussions, and I hope that you will reflect it and you will remember it during your any kinds of examinations in the future, just like the board exams, whatever. So I will give you 10 minutes for 10 minutes is too much, so I think I will give you 5 minutes for your written exam, a short quiz. I will call this short quiz. Okay, so student, thank you for your cooperation and for your time on listening to me. Okay. Okay, for our next meeting, I would like to give you an assignment. Okay, I will think first for your assignment. Okay, I wanted from you to search all about abortion. Okay, the meaning of abortion, I will give you an assignment in abortion, the types of abortion, and also, okay, by next time I will give an oral recitation about the reviewing of the pregnancy topic, the signs and symptoms, whatever like that. And also in advance, I would like to give you an oral recitation about abortion and its type of abortion. There are too many, but of course I would see to you if you did your assignment. So I would like to know if you are doing your job also. So thank you very much. Then I will not make it long. So inshallah you will get a higher grade in your short quiz. I will read all your quizzes later. So just answer it by now. Thank you very much.